a snapshot of, thank you, Erin. This is a snapshot of our groundbreaking event on Monday. We had our donors there to celebrate. We also had Merrick Egber, who is our administrative assistant, and really so much more. He's been with the organization for 7 years, and he is an adult with autism who runs our advisory board. He also writes our blog, he runs our podcast, and really has his hands in every department of the foundation. And he was able to share with everyone what the building means to him as an adult with autism, and what employment means to him as well, in that he's been with the foundation for over 7 years. We also had the chairman of our board, Marvin Shankin, and one of our graduates from one of the charter schools that's on our campus. His name is Connor, and he's been working at Public for several years now and has moved his way up in Publix from actually bagging to a cashier to now working in customer service. And so Marvin shared his story of meeting Connor and how that really inspired him to propel our employment services even further than they already were. So our campaign for this building has been Excellence Ahead. Obviously, we are the Center of Excellence, that's the name of our campus, and we continue to work towards the mission of improving the lives of individuals with autism by helping them to have their aspirations come to life. And in this building, we expect that we will really be able to set the stage for those aspirations to come to fruition. And we'll do that through therapeutic services, through employment services. We'll have our day training program, and also recreation and social opportunities. Now, many of these programs we already are providing. So we've actually been a vocational rehabilitation vendor for how many years now, Erin? Is it 6 or
since 2015, actually January 2016.
Yes. And so we actually find jobs for adults with autism and other disabilities. And we work with the employer to train them on how to make accommodations for the employees, how to help support as a natural support in the workplace through our job coaches. So our job coaches go out and provide support not only to the employee, but also to the employer. So why are we doing this? Well, 1 in 44 children are diagnosed with autism. The CDC came out with the new prevalence rates this year. And as I mentioned at the groundbreaking ceremony, these children grow up, they have grown up. We have many of them here in our campus right now, and we need to find a place that they can call home. We have these 2 education wings on our campus. We have a beautiful pavilion and our auditorium building here. And we wanted to make sure that there was a dedicated space to our adults. Right now, the programs that we run for adults are run in this building. So our adult day program is running in one of the conference rooms downstairs. It sometimes runs in the pavilion. It's also running in one of the classrooms in the Shankin Education Wing. So this new building is going to allow them to have a dedicated space for them and to really be the epicenter of practicing evidence-based interventions, refining them, and sharing with the rest of the world what are the best practices to really help adults with autism continue learning, continue growing, and connecting with others. Over 70,000 individuals turn 18 years old every single year. Many of them are not employed. There's 75% of individuals with disabilities, specifically with autism, are without employment. That's too high of a number, and we work every day to be able to increase the number of individuals finding paid employment and sustaining that employment, because it's not just about finding the job, it's also about keeping the job. And that is really a primary focus of our training of not only the employee, but also the employer, so that they can understand that every employee has to be onboarded, as we know, but it may take a little bit longer for some individuals to be onboarded. They may need some special accommodations and a little bit more repeated practice in their job tasks. And so together we form this partnership that really promotes success for the employer and the employee. So this building is specifically set to enhance employer and business partnerships. It's going to deliver programs and services directly to adults with autism and other disabilities. And also it's going to help disseminate best practices around the world. And we're going to make sure to leave time for questions. So don't think, I don't want you to think, oh my goodness, Marlene's going to talk the whole time, which I could, but I won't. And so I will be keeping time to make sure that we leave at least 20 minutes at the end to be able to answer any questions that you might have. I wanted to give you an overview of our campus so that you can see all the work that has been put in to building this incredible 26-acre campus. We have the Els Center of Excellence Administration building, which is right in the center, for those of you who haven't visited us yet. We have our 2 education wings. These 2 buildings house the 2 public charter schools of Palm Beach County that live on this campus, and we work together with them, but each school is separate from each other and separate from the foundation. And so we actually have 3 501c3s, which are nonprofit organizations, on our campus. And right outside the doors of our campus, Pam Minnelli and her husband, Dick Busto, they started the Autism Project of Palm Beach County. And right outside the gates, there's also a group home from the Autism Project of Palm Beach County. And so right in our close quarters, we have 4 nonprofits working in unison to make a difference in the lives of people with autism. Some of the special features of the building that we're going to be constructing, as well as the other buildings, is that we have state-of-the-art technology with interactive whiteboards. We have video cameras throughout the education buildings, as well as the pavilion and auditorium building, so that we can conduct research. We can do professional development with those cameras, as well as keeping everybody safe and being able to look back. And if one of our students or the foundation's clients have a challenging moment, it allows us to go back and look at the video and listen in and really determine what is it that caused that challenging moment and what can we do differently going forward to prevent or manage it better. And so these cameras are really helpful for all of us to be the center of excellence and to make sure that our programs and services are the very best. We also will include Acoustablock in specific areas of the adult services building to really line the walls and be able to keep the sound contained within each of the learning environments so that there are reduced distractions. And that way they can stay focused on what they're trying to achieve, which is to learn and grow and connect with each other. We also will be using LED lighting, just like we do in the rest of these buildings that we have on campus, to reduce the behavioral responses that come with other type of lighting that really could have some sounds to it or some flickering. And so we'll be using LED lighting throughout the building. We also have learned from the consultants that we've had here, and we've had consultants on many different levels, because we always want to make sure that we're seeking out advice from experts in different fields. And one of the architects that specializes in spaces for people with autism, she came here from the University of Cairo, the American University of Cairo, and really made us note that there needed to be quiet nooks throughout the buildings, so that if the individuals that we serve are in need of a moment of peace, of disconnect, of sensory reduction, that they didn't have to wait to get back into their classroom, that there was a space along the hallways that would allow them that opportunity. And so this new building will also have those quiet nooks in the hallways. And all the floor plan, and Yvonne can really speak to this because she has it plastered on her office wall where she makes all of her notes. She had us all look at those floor plans with a fine-tooth comb to make sure that these spaces were accessible, but that they promoted independence, they allowed for safety, and allowed for opportunities for social interaction. So there was a lot of thought put into every single space that is in this new building. And we also really took into account the color palette that was going to be used. So we looked at what the research has shown about colors, the impact of colors on learning, on sensory excitement and sensory reduction, because there are moments where you want to have a sense, a heightened sense of stimulation when you're trying to be creative, like in the Sea of Possibilities room where they're creating art projects. But you also need those colors that will help reduce sensory overload in learning environments or in those safe nooks that we're putting throughout the hallways. So a lot of time, a lot of thought has been put into every element that is going into this building. All right, I'm going to pitch this now to Erin so that she can tell you a little bit about the expansion of the programs that we already are providing for adults, but that will be expanded to a very large degree in the new building.
Thank you, Marlene. Can I ask if there's any way you can make your screen just a bit bigger? I think I may need new glasses.
So what I can do here,
if not, I know what it says. It may be helpful.
Can
Can
you see like that? Does that work?
Yeah, and you can put it back in presentation. I don't want to take up too much time. It was just really, it's small on my view. Perfect. Thank you. That's great. So thank you so much. For those of you that don't know me, as Marlene said, my name is Dr. Erin Brooker Lozott. I'm the program director and currently been an acting director of adult services. So we're very excited for this building to come to fruition, to be built. We're going to maintain our adult day training program, but have the ability to finally expand. I see some names of individuals here on the call. And so I know many people have been asking the question of when are we going to be able to have our adult child have the ability to enroll in this program, or for us to do intakes. And we need to, for space purposes right now, wait until the building is open to be able to expand our day program in numbers, as well as in the different opportunities that are embedded within the day program. So that we are piloting right now on, as Marlene mentioned, in our foundation building and in the Schenken Education Wing, where the Learning Academy is also housed, is a program that will continue and be expanded and have dedicated space in this building. With regards to our employment training and our program, we're not only going to have our work experience program that we have, that our individuals get to have a 10-week program offsite at one of our community partners, let's say the Club of Ibis, or in the past PGA National, Jupiter Medical Center, but also we're going to have full service vocational storefront labs across different industries in this building for vocational training and experiences. In addition, we're going to have a cafe in the building that is going to allow for not only work experience and vocational training for those individuals that are in our day program or in our employment programs, but also paid employment for adults with autism. So we're excited about that. With regards to making sure that our adults that we're serving have the skills that they need to be able to self-advocate for themselves once they're in the community, in the day program, in employment. We actually, as a vocational rehabilitation provider, are now able to offer a self-advocacy course, and that will start actually this June. We're going to have that in the Schenken Education Wing, and then it will be expanded once the building is open. With regards to recreation and our social services, our adults currently are able to participate in all of our rec programs that occur after school hours in the afternoon and early evenings. And so we're excited to be able to continue to offer those and expand our recreation services for our adults once we're able to expand the numbers of adults we serve in the new building. We have everything right now from golf to tennis to kickball, which who would have thought is a very sought after sport, we have our arts and leisure. We had, and I see Allie, and we miss you so much, Allie. We had a wonderful theater program we're hoping to one day have back. Depending on the season, we have art, yoga, dance, music, our interability chorus by Whole Vibes and Erica Lyles, and those will continue and hopefully grow. We, in the new building, we're going to have actually therapeutic space for not only speech and language or occupational therapy, mental health counseling, but we're also going to have a 2-bedroom, 2-bathroom apartment with a full laundry room, in addition to those vocational labs or storefronts across industries that can be used to build skills that support independent or supported living. We want to make sure that we're teaching the individuals that we serve in very similar environments that they would access outside of our campus. So it's important that our spaces lend to exactly what it would look like if you were in a house, if you were in an apartment, if you were in a community center. We don't want to teach out of context and have things be learned in arbitrary or contrived settings and then not generalize into the real world. And so for our graduates, our post-graduation, we have many programs if you're 18 years of age and exited high school. And as I mentioned, the self-advocacy course is one of them that will be continued to be offered. And we're hoping to continue to offer more and more programs that support independent living, employment, and communication, social skills. Our salsa program, which if you guys have been here for a while, that includes not only cooking and nutrition and healthy eating and living, but also fitness. We'll be able to offer that again, which we're very excited about. And that will support the recreation piece, the supported living, as well as different opportunities for employment if you've learned how to navigate through a kitchen and make food. Our micro business is something we're very excited and proud of. It's called Sea of Possibilities. It's currently embedded in our day training program, and it is expanding by the moment. I believe, I don't know if this is a drum roll moment or not, but we're going to have online ordering. If not, it's up and running. So we now have, I can say with confidence, online ordering, a Facebook page. Our Sea of Possibilities team, our staff in our adult day training program have, I want to say, about 7 events that they're doing for World Autism Month. They're going to actually be tomorrow night at Love Street, the Sea of Possibilities Art in the Heart, if you have a moment to stop by. And they collaborate with the PGA Green Market, the Jupiter Police Department. And so we're really having opportunities for our adults to learn how to work within a business within their day training program. And we are, our adults as well are starting to have on-campus jobs that hopefully can turn into employment opportunities. So this micro business will continue to expand, and we were very lucky to recently get grant funding that it can allow for a dedicated assistant just for the micro business. So there's going to be many, many things that we do, and we have our clinical staff are excited to offer programs that help with consent, healthy boundaries, relationship building that we've piloted already this year that we're refining to ensure it can be a replicable program once the building's open.
Thank you, Erin.
Yes.
Okay. So let me give you a little sneak peek here. I'll increase the size. So this is the floor plan of the building. And Yvonne, you want to jump in and walk us through this?
Sure, absolutely. As you can see, this is the first floor. We do have a number of the spaces named. So we have received a good amount of donations, and there's still a chance. If you're interested, there are rooms still available for donations and to be named. So you can certainly contact us if you're interested. But primarily, if you take a look at this, we will have 4 classrooms primarily down here, and then a 5th one dedicated to the Sea of Possibilities. As you walk in from the south side, there will be a nice waiting area for everyone to enter into. However, on the east side of the building, we will have a handicap ramp as an entrance over to the right. That way it will be easily accessible to anyone who has special needs coming into the building as well. So they can be guided directly into the individual classrooms. As you move towards the left side of the building, which is the west side, you'll see in the back is the commercial kitchen. So there will be a cafe. And the goal there is to really furnish that area to give our adults opportunities to become familiar with all kind of settings of restaurants, whether it be a Starbucks look, whether it be a booth setting, whether it be a more of a formal restaurant. So the idea is to get everyone comfortable with all kind of environments. So it's easy to transition, as well as to give them opportunities not only to work in those environments, but to actually understand the environments that they could even visit if they're not employed in those types of areas. So the back of the kitchen is the northwest side, and we will have a number of stoves with a hood, refrigeration, freezers. There'll be a separate washroom. So again, a typical back of kitchen that's realistic, so they'll become familiar. We'll also have a drive-through, which is a nice addition. So our adults can become familiar with working in a drive-through environment, as well as visiting and giving them practice for any of our parents and guardians to actually come in and get serviced in the commercial kitchen. Towards the front of the building, we will have.
Oops, sorry, Yvonne.
That's okay. That's okay. Towards the front, the north.
I'm killing you here. Hold on one second. Sorry.
I'm sorry. So I'm sorry. The south west side of the building that will be dedicated towards the staff. So where you see number 4 on the diagram, as well as that whole area, that's going to be our staff open space. That way it would accommodate our people coming in and out. We'll have a dedicated director's office down there as well. We'll have a dedicated nurse area as well. And we also will have our coordinator of the adult services down on that floor.
Okay, now I can move to the next one. All right. Yeah. All right, take us to the second floor.
So the second floor is dedicated to a number of different things, self-advocacy, as well as the therapeutic area that Erin had mentioned previously. We will have staff up there as well in section 9 that's noted and named. We will have some of the service areas, meaning for the administration of the building, IT and electrical areas. So those will also be restricted, but again, it's space to operate the building. We also will have grocery. So a number of our labs are upstairs. So we'll have a grocery area, number 7. We'll have a business center, a retail area in 5 and 6. There's activity room dedicated for any indoor sports for the adults. And in section 1, that's noted, that will be our hotel suite. So it's 2-bedroom suite, along with the laundry area and a kitchen and living space. And again, to be able to create a realistic environment for adults to become more and more familiar with the different opportunities out there in the workplace, as well as to continue to grow independent living skills amongst all the adults. And there are also, as you can see in section 4, there are 2 classrooms, and they are in the self-advocacy and work readiness space.
Okay.
Is there anything you want to add, Marlene or Erin?
Just the dedicated therapy rooms that right now we're doing mental health counseling out of the living room in our conference room here. We also have a therapy room in the in one of the education wings, in the Rupert education wing. And so now we'll be able to do mental health counseling, as well as vocational speech and language or vocational behavioral support in spaces dedicated, again, to adults, so that it's not piecemeal throughout the campus. It'll be in one place.
And just a note, because I think it is very important, not all the rooms in these in section 8 have an observation room, because there's some interventions that really, from a mental health counseling standpoint, need to be extremely private. And so, and what I really thought was wonderful about this is that there's actually a dedicated hallway into the therapy rooms versus just having them out in the hall. So if somebody is coming in and, you know, there's something happening over in section 4 that has more noise, or you hear the vocational, you know, storefronts at Yvonne, the grocery, you're really in your own space when you're coming in, especially when you're needing to discuss a sensitive topic, or if there are observation-based spaces as well for training and for learning and for other types of interventions in this quadrant.
Okay. Hopefully you all are as excited as we are. All right, let me, there we go. All right, let's look now at some of the renderings here that we've already talked about within the floor plan, but this is a little sneak peek at the rendering for the full service cafe that Yvonne already described. This is the rendering for the 2-bedroom suite. And this space is going to serve as vocational training for hospitality, but also for independent living skills. So we'll run programs to be able to teach individuals how to take care of their own apartment, how to be safe in their own apartment, how to cook in their own place and clean up. I've always said I probably should have put my son even through this type of training, because now he's in college and still trying to learn these things. And then we have our classrooms that will all have a interactive whiteboard. We'll also have cameras in there, as I mentioned, in all the spaces where clients or students are going to be attending. We'll have those spaces so that we can learn through research as well as for professional development. Then we're really excited about the storefronts, the vocational labs that Yvonne mentioned. So we are looking for partners that would like to have their name in the business storefront, as well as grocery. We'll have that so that for the grocery vocational lab is not only for working at a grocery store, but that's also going to serve as a lab for independent living skills. How do I go and determine what groceries I should be buying, looking at labels, comparing prices, making sure I have enough money to buy everything I put in my cart, because I might like all this stuff, but I might not have all the money for it, and making sure that you're getting the right change back from the cashier. So it really serves a dual purpose. And then we'll have the Golf Pro Shop retail storefront. And we're looking at the possibility of it being a Golf Pro Shop, but if we have a sporting goods store like Dick's Sporting Goods or some other retailer that would like to partner with us, we'll also be considering that. We are looking still for in-kind needs. So if any of you here know of companies that would like to partner with us and really put their footprint into this building, you can have them contact me or Yvonne, and we would be happy to work with them and see how they can be part of this great building. Just a few shots from the construction, the groundbreaking event. This is our construction crew. Everything is about a partnership, and what's great is that Yvonne has been the glue to put all of these groups together. So the Black Diamond is our construction company. Jeff Collins is our project manager. Spina Roborik and Partners are our architects, and you know, we are obviously Ernie Els Foundation, the Els for Autism Foundation, and she's done a wonderful job being able to put everybody together. We also have Raj here, who did our geo ground testing, right, Yvonne? Did I say it right?
Yes. Yes.
Okay, great. And so he's been a wonderful partner and supporter throughout the years. And you can make a lasting impact by being a volunteer to help us with disseminating information. Once we have the building open, we are going to be looking for volunteers for the cafe, for some of the vocational labs, and for the activity center. You can also partner with us by helping spread the word about these in-kind needs that we have, and that people can really partner with us and leave that lasting impact. We were really excited on Monday to have the groundbreaking and to have our ceremonial stake in the ground. And we are looking forward to all of you joining us someday when it's all ready so that we can do the ribbon cutting. And I will stop sharing so that we can take some questions. Pam, do you want to open it up and just share with us what your thoughts are on the building? You've been involved in every aspect of this project from the beginning, and so we would love to hear from you.
Sure. Monday was a great day. And my son is in the adult day training program right now with some of your sons and daughters. And it's a wonderful program. And I'm just really, really happy that once the building is up, many more of our adults are going to be able to participate on the campus. So great job, team. It's going to be a beautiful building, and we'll be here for many years to come.
Thank you, Pam. I also see Andrea here, Andrea Martin. She is a fabulous staff member from the Learning Academy, which is one of the public charter schools here on campus. And Andrea, tell us about how you see this building helping the students at the charter school, as well as other students in Palm Beach County, be able to have life beyond school.
Hi, everyone. I know a lot of you guys. So yeah, I think it's a great, it's going to be wonderful for our students that need to transition to something that's similar and to continue developing those skills and having, you know, the focus be adulthood and addressing those skills as adults. So I'm very excited to see that, you know, see everything come together and to see. I'm excited about the cafe, especially in the micro business and everything. So I think that it's just going to be great. And I think it's wonderful that individuals that, you know, aren't familiar with our schools or maybe from other campuses, you know, can come and practice those skills because they didn't have access to those things while they were in school. Maybe they were focusing on other life skills or their academics, completing those courses, and having a therapeutic center to come to do those things and maybe build a full schedule, accessing, you know, salsa, doing recreation, having therapies, being able to build that or a customizable program would be really just fantastic. So I'm excited to see all of those things come together.
Great, thanks so much, Andrea. Some of you might be thinking, well, how do I get my student, my family member, my neighbor involved in these programs and services? So first of all, let me tell you about the funding. We do accept insurance. And so for the therapeutic services, we accept a variety of insurances for mental health counseling. Erin and the employment team work closely with the VR counselors, the vocational rehabilitation counselors, so that if some of the adults need speech and language or behavioral therapy or mental health counseling in order to be able to access employment, they work with them for the referrals for those services, so that this way it's covered under VR. We also are very fortunate to have incredible funders. Our team works really hard on writing grants to be able to support the programs and reduce the cost to the families. And so, for example, our work experience program is free. We do have a registration fee just as part of the overhead, but the program, which is 10 weeks, is free because of the grants that we've received. We also, drum roll, just became APD providers of adult day training. And so Erin and the team, the accounting team, are working diligently to get that out to the families that are currently in the adult day program. So those of them who are on APD, the med waiver, can pay for that program with their APD dollars. And in addition, we also are fortunate to have our scholarship, our scholarship fund to be able to provide financial aid to families. So those who don't have APD funding, those who are in financial need can apply for financial assistance, and then we will review those applications and be able to provide support. Right now, our adult day program is full. we don't have any more space. And so we have 18 individuals that are in the program. They're in the program from 9 to 2:30 every day. They do a variety of activities, not only here on campus, but they also go out in the community to volunteer, to also go grocery shopping and then come back and cook a meal together. And so it's really about community integration. We actually purchased a vehicle, and we will have a dedicated vehicle that is wheelchair accessible. That'll be coming in, is it June, Yvonne?
The end of May.
End of May. All right. And so we will eventually purchase another vehicle as well. Right now, we have such a great partnership with the 2 charter schools on our campus that we are able to borrow their vehicles. But if they're using them, then we have limitations. So that's why we wanted to make sure to have our own vehicle to be able to have more accessibility into the community for our day program participants. For our programs, we always do an intake. And for work experience, we do actually what's called a situational assessment that Erin mentioned. And that helps us to determine whether that individual is going to thrive in the work experience placement. We don't want to put people in situations that they're not going to succeed and they're going to be frustrated, or maybe they don't even like doing that activity. For example, we have a partnership with Next Level Distribution, incredible partner. And they have their arms open saying, come on over, bring your clients, train them. If we have a position open, we'll hire some of them as well. But some of the individuals that we've put through there, they realize, you know what? I don't really want to do material distribution and order fulfillment. I don't want to work in the back of the house. In fact, one of them right now wants to be social and be in the front of the house, interacting with people. So it's a great opportunity also for career exploration and giving them that experience they need to really decide, what do I want to do? What are the things I really like? Maybe I thought I liked baking, but now when I have to bake for a job and not just bake for fun, it's not that fun anymore. And so that's really what these programs are trying to achieve.
Marlene, I think if I can just add, one of the things that we're doing to make sure that the families that have interest specific to the day program and things that may not be expanded until the building's open is to start the client application paperwork and create an electronic medical record, a portal with Els for Autism. And so right now, those individuals that are interested in getting updates, interested in making sure that they are they know up front if the programs that we're going to have come when the building opens may be available, then we are working on creating client portals for those individuals, so that upon an intake needing to be done, and upon a situational needing to be done, upon the building being open in a program having the ability to have space for expansion, all the traditional paperwork that needs to happen to become a client of Els for Autism Foundation is already in place, and there's not then again another delay. So we're calling this almost an intake list versus a waiting list to make sure that your paperwork's in place. And if anybody has interest that's not already a client of Els for Autism Foundation, then you can contact me directly and I will route you to the right person in the next step that you would need to take.
And Erin, right now we have a new work experience cohort that's going to start, right, at the club at IBIS?
Yes, in May.
You want to share that information?
Sure. So we have a 10-week program that's going to be at the Club of IBIS. We're currently accepting individuals to have intakes and situational assessments if they're interested in whether they have an employment goal and they're already a VR customer, or they want to take a career exploration track to see what industry they may want to be a part of and to establish an employment goal and a career plan. And so if anybody has an adult child or is a person with autism on this call that's interested in this work experience program and wants to be in a golf country club type of environment, please let us know, because we're actively recruiting. We're also actively recruiting for if you are a VR customer and enrolled in either the STAR program or their traditional VR program. We're recruiting for our self-advocacy course right now that will take place in June. And you can contact me. The flyers are being disseminated as we speak. So those are two upcoming programs that we're looking for participants for.
And Erin, do we have spots available for our summer camp that's going to run in July? We accept up till the age of 22, correct?
21. And
21.
yep. And
Well,
so
but
we-
if they're 20, if they're 22,
22
if they're
and
within there.
that year.
Okay.
Yes, correct. Yes, we do. We do have spots still available within our summer camp. We also have financial assistance, scholarship applications that are available to apply for summer camp. And that will run the month of July, starting July 5th through the last day of the month. I believe the Friday is the 29th. We have really great staff. Some of the staff are at either the Learning Academy or the Learning Center that will be working with us over the summer, and really great outings planned, as well as sports and recreation embedded through the day, just almost like our rec program, but throughout a moving and grooving camp. So we do have spaces for the camp as well if you have interest in your adult child, or if you have a younger child participating. And Greg Connors is our recreation services coordinator, who is taking all the intakes. But for the purpose of this call, I'm happy to route anybody to the right person, so you don't have to go searching for somebody else's information.
We will also have recreation programs starting again in the fall. They usually start like the last week of August. We give families, the first week back to school for everyone to just get acclimated if you have other children that are school age. And then we start our rec program. So be on the lookout for that, because if you're not part of the Els for Autism family just yet, and you'd like to be involved, we have recreation programs, as Erin mentioned, for all ages, from music, theater, yoga. We also have virtual programs. So for those of you who aren't here local, we run a virtual book club called Spectrum Book Club, and anyone from anywhere around the world can participate in that. And we also have a program called Connections Club, and that's also for adults. And once a month, we do a game night on a Friday night. Again, open to anyone, anywhere around the world that's an adult and wants to participate in that program. And lastly, our other program is the Spoken Wheel Society that Merrick Egber, our advisory board president and our administrative assistant, he runs that. And they do meet locally, but they also meet virtually. And so if someone's interested in participating in that, that is at no cost. And the game night is at no cost, and there's a minimal fee for the Spectrum Book Club and Connections Club. So there are lots of opportunities.
We also have a sibling support virtual room that you don't need to be a client of Els for Autism. So if any of your children with autism, or if you're a person with autism, you have a sibling that is looking for support, one of our mental health counselors runs that sibling support room. It's called Sam's Sib Stick Together Room. There's a nominal fee for a membership across the year. They meet online, and then there's opportunities for one-on-one sessions with the mental health counselor to support maybe topics that the individuals are not completely comfortable talking about in the group. And we have a dedicated website that is called Sam's Sib Stick Together, as well as a webinar series that's focused on topics specific to siblings. And so the webinar series is of no cost. The access to the website and the materials that will be on it is of no cost. And like I said, there's an annual membership fee to the sibling support room. And so if anybody has interest in that, you can let me know. It's on our website as well.
I have a question.
Yes. Hi, Catherine.
It's not Catherine, it's Liz Kubiak. I don't know why I always get on Catherine. I always get on Catherine's thing, because when we have our PTO meetings, and I try to change my name and I don't know how to do it. So it's Liz. Sorry.
Hi, Liz.
I thought for a minute that I was going a little crazy. I'm like, this doesn't look like Catherine.
I know. I
Okay.
thought the same thing. I know who that is, though.
Yeah.
All right. Hi, Liz.
I try to change it and it just, for some reason, I can't do it. So it's my idiocy here. So how long until the building is going to be ready to go?
Yvonne.
Yeah, so we're planned to have it open in the summer of 2023. Our hopes are always to be sooner, but with some of the challenges of supply chain and of course the weather in Florida, we're really aiming towards
That's-
summer 2023.
I think that's impressive for just to be a year. I don't know how you guys are going to do it, but hey, I'm praying that's going to be the case. That's wonderful. Is there anything else that the Med Waiver covers other than that one program you guys spoke of before?
Not at this time, other than we are a provider of APD supported employment for extended services. So if somebody is in employment and has exhausted their benefits through VR, we can use the supported employment funding through APD. We at this point, though, this is what we have been able to get credentialed for. It's taken about 2.5+ years to get to this point, to get a Medicaid number, to be able to be a provider of a service with APD. And then this is our second service we've been able to get compliant with. So as the need grows and we expand, once our building is open and our programs are refined, we're going to continue to investigate other funding that we can possibly take across services. At this time, no.
Okay. Okay. So is Med Waiver and Medicaid different, or you consider them the same?
I consider them different.
Did you take Medicaid for anything?
No, we do not take Medicaid for anything at this time. However, we are in the process of being credentialed for Medicare for speech and language and OT services. So if an individual has a disability and their parent is over the age of 65, they qualify for therapeutic services under Medicare. And so some of our adult clients have Medicare for therapeutic services as a primary, and then they have, let's say, Aetna through Medicare or what have you with their parent. And so this has been a current request that we've worked on, and hopefully that will be in place even prior to the building being built. That would be our next insurance company. Right now, we're in network for mental health, behavioral health in general, which would comprise applied behavior analysis and mental health, with everything from Humana to Cigna to Blue Cross Blue Shield, Aetna, and United Healthcare. We also have out-of-network coverage, and we're a provider through TRICARE for speech and language, and for OT. We have different, for younger children, we have different scholarship funds. We're Gardner Scholarship provider, VPK scholarship providers. We're looking to take ELKS therapy services, supports for younger children. So we have actually a dedicated tab on our website for the insurance coverage that we have, and who we're in network for per service that we provide. And so Medicare will be our next one for therapy services specifically.
Okay. Okie dokie. And for those of us who've already been, like Kelsey's already been in your summer camp numerous times, does that mean that she's already in the portal? She's already in your client portal?
She's already a client. Something like that situation would be that is already a client of Els for Autism. She may just need, or someone may just need to have updated paperwork, make sure if your paperwork's up to date, and you haven't done any service within that year, that you've had a waiver consent to continue services and that nothing's changed. So yes, once you have a portal, and Central Reach is the system we currently use for electronic medical record, then you are a client. And it just may be updating your paperwork per that service or per that year.
Okay, one last question. Who do I call to talk about donations to get for a named room in the building?
Well, we'll have Marlene take that one.
Okay.
I'll give you my cell phone. Anyone with a donation, you can call me anytime. 954-557-1107.
You said 951?
Yeah, 954.
954, okay.
I'm a 954 girl.
Okay, 557-1107.
That's correct. 954.
I think I have that.
557-1107. I'll put it in the chat box. I'll put my email address as well so that everyone has it.
Okay, thank you so much.
Thank you for asking those questions.
Yes. Other questions? Hi. If you can just unmute your mic.
Did I do it? Can you hear me? Okay. Hi, I'm Evan. My son is currently on, I guess, what you're calling your intake list. I call it a waiting list, but the intake list. And and I just updated all my Central Reach paperwork. So we're waiting, and we understand we've got about another year and a half. But when your, young adults turn comes up, how much lead time as a family will you get to transition your child? Because we'll be moving out of a different system into the Els system.
Yeah, that's a
So,
great question. So my hope would be a minimum of 3 months. that
Oh,
we would
okay.
be able to do this. We need about that amount of time from a records review to be able to come on campus to do intake in person, situational assessments, making sure that the program is still there. So we actually now have a really wonderful new system called One Call Now. The school systems have used this in the past, and we're making subgroups of families, informations that we have, so we can send out updates and alerts in one place. We recently sent out an all call to all clients, and you have to opt in to receiving these messages. So we sent out information requesting and to show how to opt in. But my plan is that we're going to be sending these all call messages to let you know our building is open, and this is the time that we're going to be reaching out and sending you updates. This is the potential date for beginning expansion. If you're on the list, you should be receiving a call. And so even more so than 3 months, it would be wonderful if we could start communicating about 6 months prior, and then at 3 months, and really having everybody in place. I like advance notice, so I'm going to ensure that people have advance notice. If I can control that, that's what we will be doing.
Okay, great. Now, I don't recall recently getting any type of call message, although I know before Christmas, I think a few spots came up. So should I revisit my?
No, you didn't get a message from One Call Now teaching you that Els for Autism as an organization, asking you to opt in to either email, text, or phone call. It was a more generic message that would have come to either your email, phone, or text.
I have no idea, honestly.
So we'll send out a couple more testing routes. Some people have responded. I have a report so I can look. Thank you, Andrea.
Okay.
To see. But no, your client portal, if you have one, is secure unless you've asked to become inactive. And if your email information and your phone and everything is in the system, then we have transferred that to our One Call system to send out these messages, versus everybody getting emails and not having a better, more efficient way to receive communication.
Okay, thank you.
Yeah, no problem. I promise your portal is fine. You may need to update your password, but other than that, you have a portal.
Yeah, no, I just redid everything. So, okay, all good. Thank you
We
very much.
appreciate you.
Sissy had actually put a question in the chat about connecting with more employers for employment opportunities, and our job coaches, which some of them are on this call right now. I see David here. They are working diligently every day, going out and meeting with employers, looking at postings that are on Indeed or other websites to be able to connect with the employers, and they're out there advocating to be able to get new positions. They're really good about connecting with the manager and being able to show what we can do in regards to whether it's to fill the position or to fill a need that they didn't really even realize they had, by carving out a job and taking different pieces from different staff members and making a job out of it so that those other employees can be more efficient at their work. So we carve out a job for them. And so we have a lot of employer partners right now, the Club at Ibis, Next Level, Bolay. We have the Marriott at Singer Island. We have the Marriott Vacation as well in Singer Island. So many more. Oceana Coffee. I could go on. The list goes on, and we have all of them listed on our website to thank them for their partnership. If anybody knows of someone that owns a business and would like to employ one of our clients, please have them get in touch with Erin, and she will make sure to then have either the job coaches or to have herself go out and connect with that employer.
Thank you, Marlene. Someone asked a question about where would you go to find out if your Central Reach portal needs to be updated? I realized the first link was very long, so I put in a shortened link that is directly from our website to access your portal and all the instructions for it. I also put in the email for our client account setup team that supports our Central Reach system, so that if you have any questions, you have their email right here. And from anywhere on our website, you can get to Central Reach. At the bottom of the page, there's always a little click link, as well as there's a tab at the top under programs and services that the first line is to your Central Reach portal to make ease of access.
And I saw the question here about what will our capacity be after construction? So for the day program, we will have 4 dedicated classrooms for the day program, allowing us to have, technically it could be 60 because we'll have 15 in each room. But for some individuals that need more assistance and will come with a support staff, we'll have less space to be able to serve. So we're anticipating 55. So that's a pretty big increase from 18 to 55. I can't promise that we'll go all the way right away, because we want to make sure that we have the right staff, that they're properly trained, and that we're running a place of excellence. And so we'll do it systematically to make sure that we're providing the best services to the adults. We'll also, and that's just for the day program. We're going to increase capacity also because we'll be able to have the recreation activities in the activity room that Yvonne mentioned. We'll also have the cafe. So we're going to have employment opportunities there, as well as a living vocational lab where we can serve more vocational rehabilitation clients. And we'll have a classroom dedicated to self-advocacy, which will serve students ages 14 to 21 that are in need of that self-advocacy course. That will be, that's covered by VR, right, Erin? So there's no fee for the self-advocacy course.
Correct. If you are a VR customer, like I had said in the STAR program, or as a traditional VR customer, your counselor would have to put self-advocacy on your independent plan of employment. And once it's for 14 to 21-year-olds, so it's under this WIOA transition age youth funding source with VR. And at that point, then you would be able to have VR pay us for that course for you. So we are unable to charge, and we don't want to charge, but VR pays for that as long as it's on the plan.
All right. Well, we have run out of time. We greatly appreciate your participation today, your interest in our programs, and your support. If you have any questions, you have my phone number and email address that I put on here. You can also text me. Just let me know who you are when you text. Let me know your name so that then I can connect with you. Thank you again for your support, and we look forward to seeing you again.
Thank you.
Thanks,
Thank
everybody.
you. Bye, everyone.
Bye.
Bye, Allie.
Bye, thank you.
Bye, guys. Bye.